What does Medicare Part B cover? Well, as you can see, doctor visits, preventive care, ambulance services, etc. Now, unless you're getting your Social Security benefits already, you're going to need to proactively call Social Security, go by and visit them, or just go online and fill out your application. And I recommend you do this 3 months before your 65th birthday. Now, most folks are going to have to pay $134 unless you are a high income earner, and then your costs are going to be more. That's just the way it is. Now, Part B does have a deductible of $183. Whoa, there went the ambulance. I'm glad I'm not in that today. In 2017, as well as other co-insurance you'll have to pay. So what we're going to do right quick is look a little more detail at your responsibility on the Part B. All right, so if you can look at this little example here, this is the service provided, and this is what you would pay. Again, we talked about it's got a deductible of $183 a year. Physician costs, basically you're going to have to pay 20% of the approved amount that does occur, and occasionally they do charge more, an additional 15%, which you would be responsible as well in rare occasions. Now, this covers outpatient hospital care, as well as lab services. You don't have to pay anything for that. This is tied into your Medicare A deductible. As you remember, that $1,316 would be the maximum if you had an outpatient procedure done. Medical equipment supplies, basically you pay 20% of the cost. Preventive services, you're going to have to pay 20% of the approved amount. Now, some preventive services are covered at 100%, so you do not have to worry about that, and that's a good thing. In addition, if you need mental health services, this works just like the inpatient hospitalization. For some reason, they have it under Part B instead of Part A. Works exactly the same, where as long as it's less than 60 days, you're just responsible for that deductible on Part A. But if you have to go longer than that, you can see these numbers get very expensive. And then, of course, if horrible thing happened in past 150 days, you got to cover 100% of that yourself. That's why you need a Medicare supplement in the event something like that happens. Outpatient, any type of outpatient mental health, you got to pay 20% of that, and they pick up 80%. So you can see good coverage, but there is exposures, and that's why a Medicare supplement plan is so important. All right. Well, if you have any other questions, feel free to give me a call. I'm here to help, and you have a great day.